Dr. Susan Wong, who's professor of infectious diseases at the University of California School of Medicine and medical director of epidemiology and infection prevention. Dr. Wong is going to be talking more about the safety of the vaccine. Dr. Wong?
Great. It's a real pleasure to be here with you today and to talk to you about what I thought I would do is just go through top 10 questions on vaccine safety and effectiveness. How does it work? What are some of the most common questions that are coming up? Next slide. So I thought I would start with what on earth is a mRNA vaccine. Both of the vaccines that are available in the United States today from Pfizer and from Moderna are from mRNA. That stands for messenger ribonucleic acid. What is that? That is in all of our cells, all over the place. It is an instruction set to make protein. So every time our body needs a protein, we use mRNA to give the instruction set to do it. Many vaccines up until this point would actually just inject a virus protein, a purified virus protein, to help you become immune, like for the influenza, for example, for the flu vaccine. In this case, instead of injecting the protein into your arm, it injects the instruction set, the mRNA, to make the spike protein, the top of the protein that looks so spiky in the picture on the upper right-hand corner. And that's what we can use to target the virus. This mRNA, it does not mix with your genes. It does not affect your genetic code. It doesn't do anything that affects who you are. In fact, it stays in your body for a very short amount of time to be able to make spike protein. That spike protein is rapidly identified by your body as not human. And because of that, your body is going to attack it and it's going to build antibodies, and your fighter cells are actually going to learn to recognize it so that the next time it ever encounters this virus, it knows exactly what to do. Your body will get rid of the mRNA and the spike protein, and all you'll have left is your antibody and the fighter cells that can recognize that it's time to fight when it comes into contact with a spike protein. Next slide. Slide 5, will the vaccine make me sick? So I already told you it's not alive, so it's not going to make you infected with COVID-19, but it is absolutely going to stimulate your immune system. What you want it to do is you want it to build antibodies. You want it to actually respond to this load of mRNA that's going into your arm. So you absolutely want an immune response. And so what we tend to see is that most people will have a mild flu-like symptom. It'll feel like you have the flu, but you don't. It'll feel like you have the flu, but you don't, and you don't have COVID either. You'll be tired. Some people have headache, muscle aches, chills, fevers, joint pain. Some people are nauseous, and it lasts generally for a day, but up to 3 days, sometimes rarely a little bit longer. And the frequency that happens is about 55 to 60% with your first dose. What's pretty remarkable is if you look at the arm that got the vaccine, so the people who got the saline in the arm, what percentage of them complained about chills, fevers, muscle aches, tiredness in the arm that didn't even get the group that didn't even get the vaccine? They just got saline in the arm. And in that group, it was 45%. So 45% of humans generally complain about something. And in general, it's 60% in those who actually get the first dose. What you do need to know is that it is more after the second dose. Why should that be? Because you've been boosted. Your body has seen it, and now it's going to see it again, and it's going to react. And that's how we're going to solidify this massive amount of protection that these vaccines offer. One thing that's important to let you know is don't take Tylenol, Advil, Motrin just in case before your vaccine. If you take it because you have chronic back pain, that's fine. If you take aspirin because you have heart disease, that's great. Go ahead and definitely take all of your medicine. But please do not take these medicines just in case ahead of time, because if you stop your immune response, generally what we know about childhood illnesses or childhood vaccines is that if you take these things ahead of time, if you pre-medicate, you'll have a much lower antibody response. So please don't take it afterwards. If you have symptoms and you need to respond to the symptoms and you're uncomfortable, then take it then. Next slide. Question number 6, are my allergies a risk for the vaccine? So we've heard a lot about this in the media. A few things to remember is that allergies are specific. So if you're allergic to peanuts, you're not necessarily allergic to peaches. So in general, allergies are very, very specific. So the number one reason why you cannot get this vaccine, and the only reason you cannot get this vaccine, is that you're allergic to the vaccine, either to the mRNA or something else that's in the vaccine. That is the only reason you cannot get it. And currently, I'm sorry, also if you're a child. So right now it's not licensed for children in the United States. It's also not made in chicken eggs like some flu vaccines. So if you're egg allergic, it's not going to have that type of risk for you. But we are seeing that about 1 in 100,000, so 11 people in a million, will have severe allergies. And a lot of these people are allergic to other things. And so there might just be a predisposition for these people to actually have an allergic reaction. Emergency medication is present at every vaccination site. Wherever you go, wherever you get it, they are required to be able to handle a severe allergy. And the CDC does recommend that everybody stays in the area for 15 minutes. And if you have a history of a severe allergic reaction, you should stay for 30. So allergies are rare. Severe allergies are particularly quite rare, but we are being very, very attentive because nobody wants to experience a severe allergic reaction. This is something that we all handle very commonly in healthcare. We understand that patients can come in with severe allergic reactions and we know what to do. Next slide. Number 7, what about pregnancy and being immunocompromised? That means you have something, chemotherapy, cancer, something that makes your body's immune system not function in the totally normal way. And I already mentioned to you that these people were not included in the trials. And that's generally true. It's not specific to the COVID-19 trials. Most vaccine trials don't start by recruiting immunocompromised people or pregnant individuals. So what do you need to know? First, you should know that the American College of Obstetrics and Gynecology has said that every person who's pregnant should actually be offered the vaccine. Why? Because people who are pregnant and people who don't have normal immune systems have much higher risk for severe COVID disease. So you're at higher risk for something really bad. And one of the nicest things about this vaccine is that you can give something to your baby, which is an antibody. The mRNA does not cross the placental barrier. The protein does not cross. What does cross are the protective antibodies that you can give your newborn child. Same thing with breast milk. The antibodies cross, and that's the human benefit of being able to be a parent to give to your child. The protective antibodies will protect that baby for 3 months. The issue with being immunocompromised is not safety. The issue is that you may not get the 95% effect that other people will get, but maybe it's 90, maybe it's 80, maybe it's 70 or 60. That's a lot. Remember, we were willing to license a vaccine in this country for 50% benefit. So we are strongly recommending that those with immunocompromised states talk to their doctor and absolutely get vaccinated. Next slide. And finally, number 10, can I just take 1 dose? Can I just stop after that? And how late can I get my second dose? One of the most important things that you need to know is that these trials are designed with a number in mind to be able to definitively answer a question. That question, does this vaccine work and how well, is only designed with the 30,000 person number. There is not enough time or people with the amount of time to tell you what happens with 1 dose. We all understand that, of course, it's going to start to have its effect. But is it going to be robust enough? Part of the reason why we need a booster dose is because it fades. We just told you that after active infection, it fades. So you have no idea whether or not you take 1 dose and then it would have just turned around if you hadn't gotten another. In fact, the companies knew that that was possible, which is why they designed both of them a second dose. So the only thing you can have absolute confidence about is that you will get 95% protection if you get both doses at the interval that they recommend that you get. How late can that be? In general, really most childhood vaccines, we go a whole month late without worrying about it. Is it better to be as on time as possible? Of course, because that's what was studied. But if you're a couple days late, if you're a couple weeks late, you're going to be just fine. So, some people just cannot make it for whatever logistical reasons, and we're not going to stop giving you that second dose, but you do want to try to take it as close to your expected time as possible. And I think one more slide will give you some frequently asked questions information. Great. So we do have a publicly available 25 question frequently asked questions that's posted at the link that you see below at ucihealth.org. And we do update it regularly. And we're very, very excited to be able to share all of that with you.
I do want to protect myself and others. I have an elderly mother-in-law, and so as my parents, they're in their 80s, I want to protect them also. And being vaccinated means a little bit more freedom for me. And good example for my friends, my children, my relatives to get vaccinated, and a little bit of freedom to travel if I could. It's a good feeling.
Protect myself and protect everybody. Because I protect myself, I take a shot and everybody's safe also. And my son, he have a pulmonary hypertension. That basically I take the medicine for him because he's 14 years old only.
I mean, we've had this problem with the pandemic for almost a year and a half now. And I think everybody is getting tired, and I really just, I would like life to go back to normal again. So I want to be a part of the solution.
I would tell everybody out there to get vaccinated just because we want to keep everybody safe and our vulnerable population safe. It's really important that we all come together just so that way we can end the pandemic and move on and enjoy the rest of our lives.
That vaccination, you save yourself also, you save everybody also.
Say that I'm feeling fine. I'm not feeling any nausea or anything. I think that everybody can take it, and I think that even though if you get reaction from the vaccine, it's much milder complaining to if you actually get infected by COVID. And I think that it's great if you could be a part of the solution, that we can make life go back to normal.
I would just like to ask that you think about not just yourself, protecting yourself, but protecting others. Any place you go, being at home with your with your family, being out, grocery stores, and pretty much everywhere, you are doing it as a community. You're helping the community, not just yourself.